This quote is good. It says, "A good laugh and a long sleep are the two best cures for anything." I think this really highlights that a good night's sleep really has a positive effect on us, right? And this quote says it's a cure for anything, right? So I think we really underestimate the importance of a good night's sleep. We don't appreciate the role that sleep has in our overall health, in our physical health and our emotional health. And again, this is something that we don't keep in mind as healthcare providers, as medical students, as residents, as practicing physicians. This is another thing that we sacrifice is our sleep, given our schedules, given our crazy schedules, the day shift, the night shift, the 24-hour shift, the different things that we have to do. And unfortunately, sleep is something that gets sacrificed. And sometimes we can't control our schedules, but we have to keep this in mind. And whenever we have the opportunity, and our schedules allow, we should try to take advantage of a restful sleep and a good night's sleep, because that can really have a positive impact on our physical health and our emotional health. This quote reminds us that sleeping is like meditation. It's good to rest the body, but also to shut the mind down for a bit. And that's what happens when we sleep, right? Our mind shuts down for a bit, and we can kind of rest and relax, and we kind of recharge our mind and our brain and our bodies by getting a good night's sleep. So it's very important to keep that in mind. Unfortunately, with technology and with phones and tablets and constantly, always being connected, that affects our sleep. That affects our sleep hygiene. It's having a negative impact on our sleep, which is having an effect on our physical health and our emotional health. Because unfortunately now we're connected all the time, right? So we're kind of connected to work all the time. We're connected to our friends and our family members all the time. And we need to learn to just kind of disconnect. We need to be able to just kind of log off. So we need to be able to kind of turn off or log off or disconnect and sleep. And the time of sleep is when we need to be doing that, because that time is when we recharge. So kind of like we recharge our phones, we have to recharge ourselves. We have to recharge our brains, recharge our minds, and turning off everything and allowing for a good night's sleep is a very important aspect of our overall physical health and overall our emotional health. So we need to learn to do this a little bit better. Is to turn off and log off and disconnect so we can get a good night's sleep. Like I mentioned, sleep allows us to recharge. Now our brain needs to recharge every night. So we should try to do that undisturbed. So we turn off our phone and put on silent or do something so that we're not woken up in the middle of the night and disturbed by our phone going off. So we need to give our time, we need to log off and disconnect and give time for our brain to recharge every single night. And we know when you don't get enough sleep and you have sleep deprivation, it could have a very negative effect on your overall physical health, emotional health, and your behaviors, right? We've all experienced children, right? When they get tired, they get really cranky, right? Or you may know of, or you may yourself be an adult that when you get tired and fatigued, you kind of become irritable or emotionally volatile. And we know from studies that healthcare providers who are drained and tired and fatigued, they provide less effective patient care, and they make more errors. That can affect the safety of patients. So sleep deprivation has a very detrimental effect on our performance, on our productivity, on our efficiency, on our effectiveness. So we have to keep that in mind. And unfortunately, again, this is so hard for us to do as healthcare providers. We are all at risk for sleep deprivation and probably are suffering from sleep deprivation because of our schedules, because of the movement of our shifts. So again, sometimes we can't do a whole lot about that, but maybe you can try to work out something about that. But if you can't, the days that you are able to get a good night's sleep, make sure you get a good night's sleep by turning off your phone and disconnecting, and trying to recharge on those nights when you don't have to be working or you're off, and you're able to recharge that. So keep that in mind, and it's very important for our physical health and our emotional health. And again, we know that sleep deprivation causes mood swings. It causes increased irritability. It can predispose to anxiety and depression symptoms. It causes a loss of coping skills. It causes a reduced ability to concentrate and think critically. And then with sleep deprivation, you have a lower capacity to assimilate new information and to learn new things. So again, sleep deprivation can be a major problem. And again, especially healthcare providers, we are at risk of this, and that can affect our patient care. So how do we improve our sleep? We have to focus on and recognize the importance of sleep hygiene. So there's a few principles of sleep hygiene that are important to get a good night's sleep, right? So when you know you have a time to be able to sleep and you're not on call and you're not having to work, you turn off your phone and you get a good night's sleep. These are things that can help you overall in your sleep hygiene and have good restful sleep as well. So basically, it's suggested that you should go to bed at the same time every day and try to wake up at the same time every day. If possible, again, have a routine where you go to bed and wake up at the same time of the day. We should try to aim for about 7 to 9 hours of sleep. So we should get at least a minimum of 7 hours of sleep every night. And again, there'll be some nights where you can't, but then you should try to do that on the nights that you can. You should try to limit naps because if you nap in the daytime, then you're going to be awake at nighttime. And you should only sleep only in the bedroom and not like on the couch or in a different room, right? So again, it's a matter of getting a routine and following that routine as much as possible. You should try to reduce light and bright stimuli 1 to 2 hours before bed. So all these things can really help you fall asleep and get a more restful type of sleep when you do fall asleep. Then. Other suggestions for sleep hygiene include avoid large meals and fluids in the evening for a couple hours before going to bed. Avoid exercising within 4 hours of going to bed. Limiting caffeine and tobacco and alcohol consumption 4 to 6 hours before going to bed. And avoid extreme temperatures before going to bed. So again, all these things can help you fall asleep and allow you to have a more restful type of sleep, because that's important too, is to get restful sleep. It's not just the amount of sleep, but it's also the quality of sleep. And all that is important. It's all part of sleep hygiene. Sometimes we have trouble falling asleep, right? We might suffer from various forms of insomnia, where it's an acute insomnia or more of a chronic insomnia, and there's different reasons for insomnia. Some are more related to our physical health, and some are related to our emotional health. So there might be some physical health conditions that are causing insomnia, like sleep apnea and obstructive sleep apnea, or maybe there's some illness that someone has that is causing them to have pain that prevents them from sleeping well, or there are different medications that can cause insomnia. So there's different physical health issues that can cause insomnia. Then there's emotional health issues that can cause insomnia. So when we're anxious or when we're stressed or when we start to feel depressed, that can cause us to have trouble falling asleep as well. So I think it's really important to identify what is the underlying reason for not being able to sleep. Why do you have insomnia? Is there some sort of physical health condition that needs to be identified and recognized and treated? Or is there some sort of emotional health condition that needs to be recognized and identified and treated? So it's important to try to identify the underlying reason for which you're having trouble sleeping. And once you identify that, getting the appropriate therapy for that and treatment for that can be very helpful. So I think that's an important aspect of sleep. And then there are many apps that are available to help you sleep as well. So these are some of the ones that are out there that I've heard people like and tend to use. So again, using some of these apps to help you fall asleep can be another way to help you as part of your sleep hygiene or as part of your routine. This can be helpful as well. But again, if you're having trouble sleeping, try to understand why you're having trouble sleeping. Is there some sort of physical health condition or emotional health condition that is causing you to have trouble sleeping, and try to identify it and treat the underlying cause. If possible then. So again, sleep is very important aspect of our self-care. And this is, again, one of those parts of self-care that unfortunately medical students, residents, practicing physicians, we sacrifice this because we are busy with our schedules or because we are committed to caring for our patients. So this is one of the things that gets sacrificed along with our nutrition and healthy eating habits. Sleep is sacrificed as well. But I think it's important for us to take a moment and think about our habits when it comes to sleep and the importance of sleep, and try to understand that to improve our self-care, which will help our resilience and overall wellness and help prevent us from burning out.